Again, if you're just joining us, Dr. Glenn Crawford, he's with the Atlantic Orthopaedic and Sports Medicine Group, and through the Health Volunteers Overseas program, he and his wife, who's also a doctor, have been going over to the to Tanzania, Kilimanjaro Christian Medical Center for quite a number of years, and it's become, I think, my sense, Doctor, correct me if I'm wrong, kind of a calling for you now, kind of part of your overall mission in looking at helping people well beyond New Hampshire.
It absolutely is, and it's great. A lot of the hospitals in the area, when they have equipment that they're upgrading, they will give us the equipment. At this time, there's a container that we shipped over full of medical equipment that most of it was donated from a surgery center in Salem that closed, and the hospital donated it to us because they know the work we do. So there's a brand new x-ray machine that's going to allow x-rays in the operating room, which they haven't had for a few years, and a lot of equipment to fill up the new emergency room that they just built, and also a special table for treating fractures, and that is supposed to arrive at the hospital tomorrow, actually.
That's pretty neat. Dr. Mandari, coming from the Christian Medical Center in Kilimanjaro in Tanzania, paint the picture for us a little bit on how populated of an area where the medical center is, how many people each year rely on it, and with this new equipment and services, how many more people you're able to treat.
Yeah, our hospital is a kind of a referral teaching hospital, and it is the only referral hospital in the northern Tanzania, and it caters almost 15 million people. And we usually get a lot of patients even across from the border from Kenya, down south Kenya. So we have a lot of patients. And in my department, because of the cheap motorcycle from China, how we get a lot of trauma due to motorcycle. So
road accidents.
Road accident. Per day, we might get like 10 trauma cases due to motor traffic, motorcycle accident, and most of them, they have terrible fractures, open fractures with a different pattern of injuries, and they need attention to be sent to theater for emergencies, either surgical toilet, surgical debridement.
Tell me how this started.
At the end of medical school, my wife and I spent 3 months at a rotation at this hospital right at the foot of Mount Kilimanjaro, and we always had a warm spot in our heart for it. And in 2008, we went there to try to set up a program to assist in teaching the physicians there. One of the things I find works well there is that when people finish their internship, so they go to medical school, then they do 1 year of training at a big hospital, and then they have to take at least, I believe it's 3 years?
3 years.
3 years to practice before they can specialize. So everyone who is a specialist has done 3 years as general practice. So they really understand things better than here. And I feel kind of disappointed in the system in this country because people are becoming so specialized.
Yeah.
Sometimes people will come in with shoulder pain and they might be having a problem with their heart. And if you're really specialized, you may not be able to recognize things like that.
Interesting. So it's certainly a synergistic, genuine relationship between you and Dr. Mandari. Well, Doctor, I appreciate it. Good luck on the rest of your New Hampshire stay from the Kilimanjaro Christian Medical Center in Tanzania. Dr. Crawford, thank you so much for the work through the Health Volunteers Overseas. We appreciate it.
Thank you for having us here.
All right, going to take a break on New Hampshire Today. We'll be right back.